We have the honor to present to you the study project on the integration of health campaign entitled Evaluation of the Implementation of the Integrated Vaccination Campaign Against Measles and Meningitis A in 2022 in Guinea. Assessment and lesson learned in terms of effectiveness in two health districts of the meningitis belt carried out in the region of Cancan by the Fondation Santé et Développement Durable FOSAD and the Centre d'Excellence de Formation et de Recherche sur les Maladies Prioritaires en Guinée, CEFORPAG, in partnership with the Extended Program of Immunization. To do so, after an introduction and an overview of the background, we will present the study objectives, the study methodology, and the limitation, followed by the result, promising practices, lesson learned, and implication for policies and practice and future research. Guinea is facing numerous simultaneous outbreaks of measles and meningitis, especially in the high-risk area of the meningitis belt. Mass vaccination campaigns are often carried out vertically and repeatedly for the benefit of the same target and at once one after the other. This poor coordination of campaigns have heavy impact on the health system. To reduce the impact of these with epidemics-prone disease on the children's health, the Ministry of Health and Sanitation, MSHP, organized with the support of its partners an integrated vaccination campaign against measles and meningococcal meningitis A from 9 to 14th of April 2022 in 17 out of 38 high-risk health districts in the country. The study followed up on previous case study conducted by FOSAD CEFORPAG in the Cancan Health District in 2022 on collaborative planning of the integrated campaign in a multiple epidemic context. The purpose of this study is to better document the integrated campaign by identifying promising practices, challenges, and barriers resulted to the integration. This study was carried out in the region of Cancan. It is the largest of the 8 administrative regions of Guinea, with 5 districts, 2 of which are involved in the Cancan and Sigiri study. The research question is, what are the main challenges, obstacles, as well as lessons learned and the promising practices related to the integration of the VARMEN-A campaign? To answer this research question, we set ourselves the general objective of the study to document the integrated vaccination campaign against measles and meningitis A on children from 6 months to 7 years old by identifying the challenges, the obstacles, as well as promising practices in the health districts of Cancan and Sigiri in Guinea in 2022. The specific objectives are to describe the campaign implementation process, assess the perception of the community health workers, vaccinators, and managers on the integration of the campaign, evaluate effective vaccination coverage as well as equity and effectiveness of the integrated campaign, identifying promising practices and make recommendations on the various stakeholders for the effectiveness of the future campaigns. To achieve these objectives, a cross-sectional study was conducted with a mixed qualitative and quantitative approach. A two-stage cluster sampling survey according to the WHO stratified on the health district. The qualitative approach made it possible to interview the various actors involved in the campaign. The quantitative approach made it possible to survey the heads of the families and or guardians of the children aged 6 months to 7 years eligible for the vaccination campaign in households. The numbers of clusters in the two stratas obtained after the calculation was 24. And a minimum sampling size of 366 eligible persons was expected in each stratum. A total of 5 clusters, which is 20%, were randomly drawn from among the clusters planned for the household survey in each health district to interview the people involved in the planning and or during the implementation of the vaccination campaign at the level of these health areas. Quantitative data were described by their position and dispersion parameters using Stata V16 software, a probability sampling proportional to the size of the population, and a weighting of the observations was carried out, taking into account the weights of each eligible. Sphinx software was used for qualitative data management and analysis. Participants were interviewed and conversations recorded after informed consent. Electronic forms were used in the household survey and data collection used the Open Data Kit. Approval from the National Health Research Ethics Committee was obtained before the start of the study. Each respondent or responsible person was informed of their free and voluntary participation in the survey on the confidentiality and the information collected. He then signed the informed consent form. The main limitation and difficulties in this study related to the refusal of some households to participate in the study, the absence of respondent in the household when the interviewers passed, the absence of vaccination cards and a document attesting to the exact age of the child. The participants interviewed during this study were generally in favor of the integration of two vaccines. On the other hand, some were not in favor for reasons such as the impossibility of knowing which of the two vaccines causes side effects, if any, increasing the workload of vaccinators. From the point of view of the validation of the microplants, the actors believe that it was done either at the regional or national level without taking into account their proposal. In addition, due to the remoteness of certain areas, some participants deplored the logistical difficulties of transporting vaccines and inputs to the field. The remoteness of certain areas have impacted the campaign and led the actors to be flexible and consider the local initiatives. Communication with the population were ensured with social mobilizer, community relays, the media, religious leaders, town criers, and local authorities. Vaccination coverage in this health district was satisfactory in Kankan at the average of 82.4%, in Sigiri at 54.9%. Among the 294 children over 59 months vaccinated, only 54, which is 18.36%, received the Meningitis A vaccine indicated for the age. In addition, 24 children under the age of 1 were vaccinated against meningitis when they should not. The main challenges were, firstly, for a specific case of mining and agripastoral areas, the availability of population who can only be reached mainly in the evening. The second challenge was the conflicting time with other activities related to the distribution of mosquito nets and the administrative census of the workforce. Overall, stakeholders say they are satisfied with the implementation of the integration campaign against measles and meningitis. In addition, some actors felt very unsatisfied or even not at all satisfied. The reason for dissatisfaction are, among others, the workload, which was not at all reasonable. In addition, they believe that the incentives offered was not in line with the workload. Others also deplore the delays in the payment of incentives for vaccinators and supervisors, and some actors denounced that their microplan was not taken into account. The campaign actors believe that the next integrated campaign can only be satisfactory if several factors are taken into account. Carry out a good planning. This means ensuring that it is collaborative, adapted to the realities on the field, and implemented in a timely manner. Improve the working environment of the staff involved. The interviewed actor recommend that the incentives shall be revised upward and that they shall be paid on time. In addition, they recommend that the incentives must be granted to the community heads of sectors of the neighborhood that have not been taken into account. At the end of this study, the promising practices identified are the following. Door-to-door strategy learned from the experience of the polio eradication campaign was found to be very useful in improving the effectiveness of the campaign, especially when combined with other strategies. The organization of community meetings involving local authorities and leaders were very useful for information before the campaign, participation in microplanning, involvement in the organization and monitoring of combined vaccination strategies. They made it possible to increase the adherence of the population to vaccination during the campaign. The involvement of officials and leaders of gold miners in artisanal mining areas in the organization of integrated campaign has made it possible to better mobilize women and their children. The flexibility of vaccination actors during the integrated campaign in the supply, storage, and management of vaccine and inputs, taking into account the local realities of the districts. The storage in other safe and accessible places allow to facilitate day-to-day logistics for heads of vaccination centers. The adaptation of vaccine theme taking into account the workload, the actors have extended working hours due to the inadequacy of microplans by insufficient staff in relation to the workload. Thus, these vaccinators had to work from 8 a.m. to 8 p.m. Others have requested additional days to catch up the maximum numbers of people to be vaccinated. Respect for the women's schedule in specific areas, mining and agripastoral activities where people can only be reached in the evening. The lessons learned during integrated campaign are the following. Among the 294 children over 59 months vaccinated, only 54, which is 18.36%, received the vaccine indicated for the age Men A. This could distort administrative vaccination storage. During the COVID-19 pandemic, the continuity of care and service was strongly impacted. The routine vaccination system weakens. Vaccination coverage surveys were an opportunity to identify zero-dose children and take measures to vaccinate them. The administrative vaccination coverage is varying from 93% to 99.9% for measles and meningitis in the 2 health districts. 7 were well above those found during the post-campaign cluster. The administrative vaccination coverage varying from 93 to 99.9% for measles and meningitis in the 2 health districts. 7 were well above those found during the post-campaign cluster coverage survey. 92.4% for Kankan's health district and 54.9% for Sigiri's health district. The same target population is necessary during an integrated campaign to avoid vaccinating children who are not eligible for one of the antigens vaccination campaign. 19.5% children eligible only for vaccination against measles have been vaccinated against meningitis. In conclusion, the study was carried out from 11 to 20 of May 2022. Its objective was document the vaccination campaign. It identified obstacles and challenges in the 2 districts of the meningitis belt. Obstacles as well as the promising practices in health district of Kankan and Sigiri in Guinea. It was possible to conduct a cross-sectional cluster survey according to the new World Health Organization guidelines with a mixed qualitative and quantitative approach. Vaccination coverage in this health district was satisfactory in Kankan at 82.4% and a moderate in Sigiri's region, 54.9%. Some actors in the field of this study believe that the microplans were not in a line with those submitted to the central level. The challenges were mainly of 2 orders: relating to the vaccination system, vaccinators, and competing with other activities, the unavailability of population both in mining areas and agripastoral environments. Although generally satisfied with the conduct of the integrated campaign, people interviewed recommend adapting the collaborative planning to the realities on the ground and improving the availability, organization, and working condition of the people involved in the campaign. The final results were considered significant, very informative by all stakeholders. They will serve as a solid means for advocacy and the integration of different health campaigns and serve as a basis for good practices. Thank you for your attention.